The crushing weight of medical debt. Susan's story and the fight for financial freedom in America. Susan's grief over the loss of her husband of 44 years, a loss compounded by COVID-19 related respiratory complications, was cruelly interrupted. 2 years after his passing, a chilling phone call shattered the fragile peace she had begun to find. Her attorney informed her that the seemingly settled Medicaid bill, a bill she believed had been fully covered, was now demanding repayment. This wasn't a simple oversight. It was the beginning of a harrowing journey into the labyrinthine world of American medical debt. Susan's story, though deeply personal, reflects a widespread and systemic crisis. The staggering statistic, 100 million Americans burdened with an estimated $220 billion in medical debt, paints a stark picture of a nation grappling with a financial health epidemic. This debt isn't merely an inconvenience. It's a generational curse, trapping millions of low-income families in cycles of poverty, hindering their ability to achieve basic financial milestones like home ownership and car ownership. Children grow up witnessing the constant struggle, inheriting a legacy of financial instability. In southwestern Ohio, a beacon of hope is emerging. A collaborative effort between local activists, medical centers, and the Boston-based nonprofit Undo Medical Debt, formerly RIP Medical Debt, is underway. This ambitious initiative aims to alleviate the crushing weight of medical debt for thousands of residents in a region grappling with some of the highest medical debt rates in the nation. Approximately 13,000 individuals, collectively owing over $22 million, are eligible for relief. The ingenious approach involves acquiring bundled portfolios of debt from debt-collecting agencies at a drastically reduced cost, $1 for every $178 of debt. For Susan, this translates to a potential debt elimination with a mere $264 donation. Ben Merrick of Bon Seckers Mercy Health in Springfield, Ohio, highlights the urgency of this campaign. It's a very troubling story when you hear patients who defer care because they are worried about the cost of health care. People fall through the cracks. They are in insurance donut holes. Their insurers deny their prior authorizations that were approved. This speaks volumes about the flaws within the system, forcing individuals to choose between their health and financial stability. The American healthcare system, a source of both life-saving care and crippling debt, stands in stark contrast to universal healthcare systems in many other developed and developing nations. The irony is palpable. Ohioans in 2020 paid more per capita for healthcare than residents of California, Washington State, and Texas, despite the latter states having significantly higher income levels. This disparity underscores the systemic issues contributing to the medical debt crisis. The initiative, spearheaded by the Collaboratory, a local nonprofit, requires over $127,000 in donations to achieve its ambitious goal. This represents a small fraction of the overall debt burden, yet it holds the potential to transform the lives of thousands. This isn't merely charity. It's an investment in community well-being, a step towards dismantling a system that perpetuates inequality. Susan's case highlights the insidious nature of Medicaid estate recovery. After Ohio discovered her husband owned a mortgaged home, the state initiated its estate recovery process, a legal but arguably aggressive practice mandated by federal law. This action placed a lien on her home, despite the fact that Medicaid estate recovery in Ohio is only legal after the death of both the recipient, after age 55, and their spouse. The lack of clear notification regarding repayment requirements further exacerbates the situation, leaving widows like Susan vulnerable and confused. Ohio lawmakers are currently considering legislation to mandate clearer notifications within Medicaid applications. Susan's desperate attempts to navigate this complex system, contacting Medicaid, the Ohio Attorney General, and seeking a second mortgage, underscore the helplessness many face. The system, designed to provide assistance, has instead become a source of overwhelming stress and financial hardship. The efforts to address medical debt are not new. The 2021 American Rescue Plan Act saw dozens of cities utilize funds to purchase the medical debt of low-income residents. This wholesale approach reflects a growing recognition of the crisis and a shift towards community-based solutions. However, Some experts argue that these efforts, while well-intentioned, have had limited impact on individuals' lives. The focus is shifting towards citywide initiatives, aiming to create a more comprehensive and sustainable impact on entire communities. The fact remains that medical debt in America has reached epidemic proportions, despite the vast majority of Americans having some form of medical insurance. This highlights a deeper systemic failure, a failure that traps individuals in a cycle of debt, preventing them from achieving financial stability and hindering their overall well-being. Susan's story serves as a stark reminder of the human cost of this crisis, a crisis demanding immediate and comprehensive solutions. The fight for financial freedom from crushing medical debt is not just a battle against numbers. It's a fight for human dignity, a fight for the chance to grieve without the added weight of financial ruin. It's a fight for the future, ensuring that future generations aren't burdened by the same crippling weight of medical debt that haunts families today. The call to action is clear. Support initiatives like the one in southwestern Ohio, advocate for policy changes, and demand a healthcare system that prioritizes the well-being of its citizens over profit. The cost of inaction is far too high.